Thank you for attending our infection prevention training session. The objective today is to learn how to effectively practice infection control to minimise the risk of getting COVID and other infections. Our audience today is the nurse and reception staff at our medical centre. So what is infection or an infection? It is when a microorganism enters a person's body and causes harm. We've all had an infection at some point through our life, most likely viral with the common cold. There are three main types of infections: viral, bacterial, and fungal. Infections commonly spread through physical contact, transfer of bodily fluids, and contact with the same object as someone who is sick. In high-risk areas of infection, there are processes put in place to minimise the risks. Medical centres, hospitals, and aged care facilities follow strict infection control measures. Masks are not the sole equipment used to stop the spread of diseases. These measures also consist of hand hygiene, cleaning routines, use of PPE, effective waste management, social distancing, and correct needle blade disposure. It is important to follow these procedures to make sure no infection is taken home to your loved ones. We are all going through COVID-19 at the moment, so we have a higher chance of taking any diseases back to our families who might be a high-risk category. It is our job to stay safe to protect not only ourselves, but colleagues and our loved ones at home. The World Health Organization states that scientific evidence suggests that appropriate PPE use, hand hygiene, best practices, implementation of universal masking policies in healthcare facilities, and control training and education are associated with decreased risk of COVID-19 among healthcare workers. Today we'll discuss what we can do and what Helios offers to support us in infection control. So what is PPE? PPE stands for Personal Protective Equipment. There are a number of different occupations that require PPE. Medical centres consist of, but not limited to, goggles, masks, gloves, gowns, shoe garments, and face shields. The sole purpose of PPE is to protect you from getting an injury or an infection. PPE relies on human participation and involvement to be effective. That means you. Incorrect use is ineffective. Masks have become the most prominent in today's age because of the pandemic. Hand hygiene is also important. It's one of the key measures to stop the spread of any germs. WHO, the health organization, target hand hygiene because it's main pathway of germ transmission. Their most common motto is save lives, clean your hands. Hand hygiene is a term that refers to any action that is hand cleansing. This may mean using sanitizer or a hand wash. Either are appropriate if done correctly. If done incorrectly, there will be traces of germs left on the skin that can easily spread through the workplace environment, not only making yourself sick, but others sick too. There are 5 key moments to remember when using hand hygiene. These are before touching a patient, before a procedure, after body fluid exposure, after touching a patient, and after touching anything a patient has used / the surroundings of the patient. You will notice this sign on the screen is also located in our bathrooms, treatment room, and at the front desk. It only takes 1 minute, 60 seconds to clean your hands and save lives. Do you know how to put on PPE correctly? To be honest, I didn't know before COVID, so I imagine a lot of you don't know how to either. The most important step in putting on PPE is not to touch your mask or face while wearing the mask. So I'll show you how to put PPE on. You start with your sanitizing of your hands. Getting in every area you need to get in. You grab the edges of your mask, put on your ears, and just pull up the top, and there's a little wire there. You then put on your gown. And then last, your gloves, which go over your gown. important to be confident in following procedures for infection control and PPE use this week. Time will be allocated to you to do everything that's necessary, but we do have a lot of online training that will be happening. So on your next shift, please do a hand hygiene module that's online, and also do your litmus in infection control and PPE, which will explain how to put on PPE appropriately. Just a reminder to everyone to log all reports through QPulse. This includes any possible COVID infection that might occur. If anyone's not wearing a mask as well, you can also log that on QPulse. If you're unsure, just let me know and I'll walk you through how to do that one. So as we all know, COVID has enforced new measures of infection control not used prior to 2020. As listed here, we must adhere to these. A checklist is available online if you need. And I've also got it on the computer. We have to do the routine cleaning of these allocated areas every 2 hours. Just also a reminder to sign in on your way to work and take your temperature, not to come to work if you're sick. So equipment available. So when you're coming in, you should get a mask when you come in. And that should be it that you need. Make sure you're taking your temperature like I said. And the cleaning supplies will all be on the isolation trolley at the front. So, are there anything that you can think of that might be some barriers us moving forward with the infection control procedures that we're putting in place?
What happens if I'm alone on shift and there is a spillage in the area that I need to clean up? How do I attend to the patients first and then address the spillage, or spillage first?
So probably the spillage first, only because it's a way of infection getting out to other patients. Just say to the patients in front of you, I'm really sorry, I just have to deal with this quickly, and just do as much as you possibly can. Even if you just put a sign there that says, you know, do not use this area, or the mop sign, the wet sign. If you just put that there, just so no one can get to it, then come back to it after you've served the patients with the spill kit that's located in our treatment room, that should be effective. And then these slides will be available for you after. Done.